Bonjour, muharos, sawubona, assalamu alaikum, and hello. Welcome to this discussion brought to you by BBC Africa. For the next 30 minutes, we will be talking about how you can travel safely during this pandemic, especially now that countries have started opening land and sea borders, with some resuming international travel. My name is, of course, Maya Hayakawa. Now, Africa has surpassed the 500,000 mark of COVID-19 cases and has recorded more than 11,000 deaths. The World Health Organization attributes the rise of these cases to countries easing lockdown measures and people starting to move around again. And speaking of movement within the continent, the African economy has been hit hard by the pandemic, especially the travel and hospitality industry. Billions have been lost, and many in these sectors have lost their jobs. Joining me in this discussion is Mr. Barry Kashambo, the Regional Director, Eastern and Southern Office of the International Civil Aviation Organization, and Dr. Mary Stevens, an epidemiologist from the World Health Organization. So do send in your questions, whatever comments that you may have for our guests, and I'll definitely hand over those questions to them. Thank you for tuning in. Now, also thank you to our partners, Times Television and Capital FM in Malawi, NBS Television in Uganda, Splash FM in Nigeria, YFM in Ghana, QTV in Gambia, and Sky Communications in Liberia. Before we engage our experts, let's hear from Kumba, a travel blogger based in Cape Verde.
As a traveler, I feel stuck. I feel a little stuck because here international borders have been closed since the month of March, and even national borders are closed, meaning that we cannot travel to other islands. But one thing for sure is that the pandemic will definitely not going to stop me from traveling again. Of course, I will be expecting some measures from the airports and airlines, using masks, social distancing. I don't mind the longer process at the airport, but I really hope also that airlines will do social distancing and empty some seats. Already now, some airlines are literally doubling the price of the tickets. And we know that Africa is already one of the most expensive continents to travel to. And so I think that increasing the tickets and making it like very expensive can refrain people from traveling and traveling to Africa. And that can have like a really bad impact on our tourism.
All right, then. I'm just going to start off this conversation with Mr. Kashambo. I'm interested, Mr. Kashambo, in giving us perspective in terms of how much has actually been lost in the industry. From what you've heard, how big has the impact been?
Oh, thanks very much for hosting us. The impact has been tremendous, devastating, I must call it. In Africa alone, the air transport industry has lost over $10 billion in the last 5 months. And this is a conservative figure. So if you compound it with the hospitality industry, you are talking of massive amounts of losses that have been, not to mention the loss of the jobs that have been lost. The aviation industry alone employs more than 24 million persons. And if you look at the end of it, more than half of those are already getting affected, either in terms of losing jobs or losing or having pay cuts. So I would say that the pandemic has had tremendous and devastating effect on the aviation and hospitality industry as a whole.
Mr. Kashambo, obviously, airlines are now looking to start resuming their flights. There's a question here by Simoni Mohan, and this person is asking, some airlines, especially Emirates, have fitted their aircrafts with HEPA filters. Will that result in an increased level of safety during travel?
I must say that we have come up with some kind of recommendations on the best way to increase on the safety of travel. But here you're actually talking about two things. There's the safety of travel in terms of aspects of the aircraft safety and also in public health aspects. And we've been working very closely with the World Health Organization. We have come up with guidelines on how to increase and improve the public health factors. So the filters is one of the issues. Many other operators are coming up with different kind of mitigation measures, but we all are working towards one goal, making sure that the public health or the health of the public, of the passengers and the traveling public is maintained. This is why we came up with the issues of wearing masks when traveling. But World Health Organization is very critical, and we are partnering with them on a daily basis to ensure that we have measures that are going to be acceptable internationally. Our primary goal is to make sure that the traveling public is safe, and we curtail and we prevent the spread of this virus through air transport.
So, Dr. Stevens, obviously, Mr. Kashambo has highlighted that the authority is working in conjunction with the World Health Organization to ensure that there are measures in place at airports to ensure that everybody is safe. So what can people who want to travel expect at the airports?
Good afternoon, and thank you for having us once again. Yes, so we need to make sure that the travelers are safe by ensuring that all public health measures are put in place to ensure safety of the traveler. So one of the things we know, the basic preventive measures, the issue of maintaining hand hygiene, having a lot of hand washing stations or sanitizers around that people can use, observing respiratory etiquettes, the issue of maintaining at least 1 meter distance from others, and wearing of their face masks, ensuring that surfaces that are frequently touched are cleaned regularly and disinfected, and reducing as much as possible contact with travelers. So with this, and they need to understand why they have to do this and the information available, and their willingness to adhere to these measures as well for the travelers.
Dr. Stevens, a question here from Tapiwa Kaseke. Tapiwa asks, can you travel with infants who are 8 months old? Quite a specific question there, but obviously there is a concern in terms of the safety for minors. What advice would you give Tapiwa?
Yeah, so it's possible to travel with an 8-year-old, but they should know that no matter the measures you put in place, you are definitely reducing the risk to the BRS minimum. But of course, you are not eliminating the risk 100%. So they have to make that decision. And if they decide to travel, to make sure they observe all the preventive measures.
Dr. Kashambo, this question of maintaining social distance in a plane, is this practical?
That's a very good question. Yes, it is practical, but it has several consequences. And I want to specify here that ICAO and the World Health Organization are not coming up with mandatory requirement to say you must have 1 meter or you must have a separation in the seats. We are leaving it to the operators and the states to make a decision. What we are giving them is guidelines and recommendations on something that can improve the safety. So yes, it is practical, but it has a cost implication. If you have an aircraft that is supposed to be carrying 100 people and you're going to put 1 meter social distance, then you're going to reduce the number of passengers to even less than 50. So the break-in factor for the operators is going to be a big challenge. And this is going to have an impact on the cost of the travel. The lady from Cape Verde mentioned it very well. She said the cost of the ticket is already going up in her country. And this is also going to be experienced as long as we are going to be observing some of these social distances. So it is practical, but it has got implications, cost implications and other implications.
Richmond here asks, why do we seem to be in a hurry to travel? Let's note that there is life after COVID. Support our leaders to eradicate this pandemic. Your opinion, Dr. Stevens, do you think that it's too early to open up our borders? Is it really appropriate to travel right now in the middle of this pandemic?
Okay, so countries are trying to balance the public health interventions with the economy. As you heard from the ICAO director, the economic impact on closure of these borders. So now we have a guidance on what they may want to consider before they open the border. So looking at the epidemiological situation to see whether they have some level of control for the outbreak, and then looking at their surveillance system, their ability to detect additional cases early enough and to do contact tracing, and the health system as a whole, their capacity to cope with additional number of cases that would be imported. So that is very, very important. So they have to do this risk assessment before they look at the possibilities of opening the borders and, of course, ramping up capacity for potential increase in number of cases in country. On whether or not we have to travel, I think it depends on the traveler. The countries can make their decision based on the risk assessment, but the traveler also has to make that decision. Whether this is an essential travel for you, is it possible? Can you delay it? Knowing that we cannot eliminate the risk 100%, so people have to decide on what to do.
Right. Thank you so much for that, Dr. Stevens. A look at some of the other comments coming in here. David Moyo, Sakua, thanks for watching. Says here, only those who have been tested negative for COVID-19 should be allowed to travel, but the test should be done twice. The first one, then after 14 days, if still negative, then let the person travel while still observing prevention measures. We need to move on. We can't remain idle forever. Keep sending in those comments. Yes. Keep sending in those questions. For now, take a look at this. But it's not only air travel that is resuming. Countries like Mozambique have opened their land borders. However, they are not issuing any new visas. Kenya, Nigeria, and Rwanda have also opened their borders, but those coming into these respective countries will be subjected to temperature checks. Let's listen now to a backpacker, Vincent Odur, who shares his fears when he starts moving again.
I fear the fact that there is the 14 days quarantine. Like when you go to different countries, they have to take you for the 14 days to monitor you and see how your health is. You know, number two is the stereotype that people actually have, the fear. People know that there have been coronavirus cases in Kenya. So I fear the fact that when I go to a different country, people will fear the fact that I'm from a different country and the country has got cases of coronavirus and they might think that I have the coronavirus. So,
Odur just sharing some of his fears when it comes to moving around again and traveling. More comments here. Nyake Kalon says people who are traveling to other countries should all be tested for COVID and should be quarantined appropriately. I have seen social distancing working well, especially across the globe. Hope this mess will be over soon. A comment here from TTT. You cannot pick the economy over health. It's not working. Look at the US. We are dying trying to keep the economy going. That is insane to me. Abu Bakar here says travel will be full fear and skepticism, but gradually the phenomena will be normal. Kelsey says there's really no need to travel to any other country. It's risky. Some of the sentiments coming out there, Dr. Stevens. So you've heard from the backpacker who just basically shared some of his fears, some of his concerns. So what are some of the checks that long-distance travelers will need to have and the considerations that those who are traveling long distance by road will have to consider?
Yes, so I had the comments, and of course, those are legitimate comments and concern, and some of these measures is left to the countries to decide. We provide them the guidance and also the traveler as well, assessing the risks. For long distance road travel, they have to make sure that there is enough ventilation within the vehicle and observing at least the 1 meter distance as much as possible. So not the way we used to fill the buses with people, but making sure that we have that space, ensuring that people are wearing their face masks, and making sure that surfaces are cleaned regularly, and the travelers must also maintain their hand hygiene. they can have their own sanitizers and use them regularly. So they have to, throughout the travel, make sure that they are observing all the preventive measures, including making sure that they have cross ventilation within that vehicle as they travel.
There's also a lot of stigma that's happening right now, especially for those who are being, infected by COVID-19. How can we address this particular problem, Mr. Kashamba?
Thanks very much. I think one of the key words that I wanted to be going backwards a little bit. My colleague mentioned one key word that I would put here is risk assessment. Risk assessment at all levels, by the operators, by the travelers, by the government. Everybody must do some risk assessment. You talked about stigma. Yes, there is a stigma. How do we handle it? One of the biggest challenges we're going to have with this virus is mental health. Extremely important factor. People are going to be affected because we are going to what is now being called the new normal. It's different from what it was 4 months ago. At the beginning of this year, the way the world was is not what it is now. So we have to live to adapt to these new means. To live with wearing a mask, no greeting, no hugging, no traveling close to each other, whether it's by road or by air. So I think one of the biggest tools that we have to do is awareness and education. Make sure that our people, everybody is aware that there is a new change, things have changed, and we have to live with this new aspect of life, health measures, health precautions, and so on and so forth. So you are right, there's stigma, but we need to, first of all, to make sure that that this is a disease that is like any other disease, and we shouldn't, because there's a lot of recovery. The number of people recovering is much, much higher than those who are dying. So it is a recoverable disease, and we must live with it. And people need to be assured that, yes, there is a disease, but it can be dealt with. Thank you.
During the 2009 swine flu outbreak, the World Health Organization did not recommend travel restrictions. However, scientific research based on mathematical modeling indicates that restricting travel can either limit or not play a big role in stopping the spread of disease. Historical records of previous influenza pandemics, as well as experience with SARS, have validated this point. So, Dr. Stevens, off to you. With temperature checks in all entry points, how will asymptomatic symptoms be picked up?
Okay, so just to say that every outbreak is different. I've heard the statistics from previous SARS outbreak and other respiratory outbreaks. We are seeing a little bit different scenario with the COVID-19. For us in Africa, the initial measures that countries have taken with the screening at the points of entry and additional quarantine and follow-up of travelers has helped quite a number of countries to reduce the number of imported cases and slow down the progression of the outbreak. So we are trying to document this as well so it can contribute to the body of additional evidence. So with temperature screening, yes, if an individual is not febrile, it's possible to miss that person. So now they need to do the temperature taking and also physical observation. So let's say an individual decides to be mischievous. I know I have fever, and then 30 minutes before the travel, I decided to take paracetamol, for instance. Of course, even if you're febrile, the fever will not show. So, but the health workers doing the screening and observation can actually tell if someone is looking ill or not, and they can further assess that individual. Secondly, the temperature check and the physical observation is not enough. We have to follow up these travelers for 14 days. So it's up to countries what they want to do. Some of them are considering quarantine. Some of them are considering self-reporting and follow-up. So whatever it is that a country decides to do, we need to make sure that we are monitoring these people until they have finished the 14 days. Then they can be allowed to interact freely with other people.
More comments coming in. Susan
Can I add
Banatine
something
says
after that?
Yeah, sure, go ahead, Dr. Kashambo.
I think it's, thank you very much. Statistics notwithstanding, I think we also need to learn from lessons. From the past experience, and if you are looking at this particular incident, it is factual that the travel across the continents was a key element or key component of the spreading of the virus. So it is important that the travel restriction had to be put in place if we were to prevent the spread of the disease in this particular case. Thank you.
Right. Over here, a comment from Susan who says, prevention is better than cure. Only travel if it is a must. And like Dr. Stevens said earlier on, you'll really have to assess for yourself how essential it is for you to travel. Is there a way that you can delay these travels if possible? And another comment here from Asama who says, when our borders reopened and operating flight to travel, some of us are stranded here in Dubai because of health conditions. A real concern there for people who are living abroad and are looking to come back home. Dule Jolly says, is there any time limit for the vaccine availability? Dr. Stevens, over to you. A lot of people are asking this on Facebook. They're asking how long this pandemic will end. Some people have raised the question on when a vaccine is likely to be ready. Is there any progress so far in terms of having a vaccine?
Yeah, so there has been a lot of research in terms of looking for the vaccine for COVID-19, but we still have a long way to go. If you look at the previous diseases for which vaccine have been discovered, it takes some time to find the appropriate vaccine. And of course, the latest development is that African countries are now beginning to enroll in clinical trials for these vaccines, starting with South Africa, which is a very good development for the continent. So it will take some time. Looking at the outbreak, when is it going to end? The answer is we don't know. We have to be ready to live with the new normal. So as we continue to look for vaccine and of course therapeutics for this COVID-19, but I don't have a specific deadline for this. So let's just brace up and get ready for living with this virus for some time.
Mr. Kashambo, of course, a lot of our viewers are really asking a lot of questions on what some of the guidelines are about airports having public health corridors. I know that your institution have actually published some of these guidelines. What are those guidelines?
Yeah. Yes, thank you very much. These guidelines, as you mentioned, we have published them. The public health corridor guidelines, together with, in consultation, strong consultation with the World Health Organization, and they have been very helpful. Some of these are to do with crew, flight crew. How do you handle flights when the crew have to go from one state to another and go back? And these have been very useful, especially when it comes to the cargo flights and repatriation flights. How do we handle the passengers as we come up with concrete methodologies in which for social distancing? How do we handle because we are still doing some research, as the doctor mentioned. How do we handle the situation? Where do we continue to travel as we are waiting for a vaccine to be found? So each state is being given the money to implement the public health corridors, and they have done very well, especially in the cargo flights operations. And there's being translated into the public transport, and we have done it. It's been tested, and it's proving to do very well with the repatriation flights as we go into the domestic and international flights opening.
Mary here says, for the sake of economy, I think lockdown should be over and borders be opened, but adhere to safety measures. Tame says here, probably nationals who traveled out for studies-related issues should be allowed to return home and possibly quarantine them upon returning, ascertain their health conditions. So a question there as to who should be allowed to travel. Speaking of measures, to give you a glimpse on some of the restrictions that countries have been put in place, here's a breakdown from BBC's Victor Chege.
if you thought travel was hectic before because of all the paperwork, the packing, the vaccinations, I mean, who likes needles, am I right? Wait till you see what you'll have to do now. In Senegal, land and sea borders are closed indefinitely. International flights will resume on July 15th, and those arriving will be tested for COVID-19. Individuals who test positive may be required to isolate in a government-designated facility. Now let's head over to East Africa, where the Rwandese government says all passengers, including those in transit, will be required to have a COVID-19 free certificate, which should have been taken 72 hours before departure. Those who will be staying will be tested again and will wait for their results at designated hotels at their own cost. Now, in the south, Mozambique will not be issuing any more visas. Those arriving at the airport, regardless of citizenship, must be quarantined for 14 days. The same applies to anyone who has had direct contact with a confirmed COVID-19 case. Up north, Tunisia has resumed international travel to some countries. They have a color-coded system showing which nationals can visit based on the risk. Those on the orange list will need to provide a COVID-19 free certificate not older than 72 hours, while those on the green list will need to fill an online form. So, if you want to start moving again, make sure you do your research properly. I mean, a regional bloc can have their own set of rules, but the country you want to go to might have even more stringent regulations. Yeah, and if you thought travel before this pandemic was expensive, keep in mind that it might be even more expensive this time round.
Really informative. Dr. Stevens, from Victor's report, we can see that a lot of countries are actually requiring for a COVID-free certificate for them to be able to travel. How effective is this, considering that you might be tested negative today, but tomorrow be exposed to the virus?
Yes, so the issue of testing is one of the hot topics being discussed since the countries started considering reopening their borders. So now, just to say that it does not, having a negative test before you travel does not automatically rule out the risks of COVID-19. So we need to get this clear. And of course, we have seen a very good example of what happened in Seychelles recently. If you remember, they had only 11 cases that have all recovered. And then they had this international shipping vessel that brought in some travelers by air. And then out of these people, about 70 tested positive. And these people were tested prior to departure from the countries that they left from. So now this shows that whether or not you test before travel, it does not eliminate the risk. Like you said earlier, it's possible that an individual can test negative while still incubating in the early days, and then, of course, later on test negative. So I just want to reiterate that no measure works in isolation. We need to look at comprehensive measures in terms of prevention for travel.
Mr. Kashambo, briefly, traveling in Africa around the continent is already quite expensive, and a lot of Africans, therefore, prefer to travel to Europe, for example. Do you think that this is an opportunity for Africans to explore the continent a little bit more?
Yeah, that's true. You have hit the nail on the head. We need to explore our own continent. As you mentioned, connectivity in Africa has been a big problem. The travel cost in Africa has been very high, and this has been a conversation on the table for a long time. We have we already had an initiative called the Single African Air Transport Market, SATAM, which was launched in 2018. This is an opportunity for us. And we have there is a task force, which they call the High-Level Task Force for Recovery of Aviation in Africa, which was established, on which I'm fortunate to be a member. We're looking at what can we do as Africa to make sure that not only do we recover the aviation industry, but put it to another level of resilience and make it support the hospitality industry, the tourism industry, so that we get from where we were to a better level even after the COVID-19.
Mr. Kashambo and Dr. Stevens, let's leave it there. Thank you so much for joining this Facebook Live and for sharing your expertise. I hope you learned something new from our guests. And just like Victor says, if you thought traveling was expensive back then, think again. Only move if you have to, and if you must, make sure you take care of yourself. Remember, you might not feel sick. You might not also feel unwell, but the virus is circulating. It can seem simple, but it's these steps that make the difference. You can protect yourself and others from infection by washing hands with soap and water, or using an alcohol-based rub frequently and not, of course, touching your face. Also, wear your mask when you're in public spaces. We'd like to appreciate your participation with us today on this BBC Africa Facebook Live. Thank you also to our guest, Dr. Mary Stevens from the World Health Organization, and Mr. Barry Kashambo from the International Civil Aviation Organization. And of course, thanks to our partners, Times Television and Capital FM in Malawi, NBS Television in Uganda, Splash FM in Nigeria, YFM in Ghana, QTV in Gambia, and Sky Communications in Liberia. My name is Maya Hayakawa. Goodbye, and please keep safe.